Hello, hello, hello. Hey friends and followers, it's Devon from the Sea Turtle Hospital at the University of Florida's Whitney lab. We'll give you guys a couple minutes to get on. I apologize for the delay. Our turtle friends don't know how to tell time. But today we have Dr. Brooke with us, and we are going to be doing surgery on Miss Eugenie Clark. You guys know Miss Eugenie Clark. She's been with us for a little bit now. Give you guys a couple more minutes to pop on. It's a little overcasty, but we're in beautiful St. Augustine, Florida. And we are going to be doing Eugenie Clark surgery today. So we wanted to pop on for Wellness Wednesday and say hello. Got a couple folks joining us. Alrighty. So we are here today with Dr. Brooke and Eugenie Clark, and she's going to be getting prepped for surgery. As you guys know, we are in St. Augustine, Florida. We are the Sea Turtle Hospital at the University of Florida's Whitney lab, and we work with the green sea turtles that have fibropapillomatosis. So once our animals get healthy enough, they're able to undergo surgery to remove those tumors, and we use a CO2 laser in order to do that. So what you guys are about to see today is Dr. Burkholter prepping Eugenie for surgery. Hello from Illinois. All right, so we're gonna step in to our treatment room, surgery room, and say hi to some of the team. Thanks for joining us. So this is our treatment surgery room, where some of you guys might be a little familiar with. Our treatment board, Delta, Edward Scissorhands, Eugenie Clark, and Richard. And we are just getting prepped for surgery this morning. Again, I apologize for the little delay. We have Jessica and Dr. Brooke here. And this is Miss Eugenie Clark. Hola, Nadia. So Miss Eugenie Clark is going to get some tumor removal surgery today. You could see those spots are from her past surgery. All those scabs, that's looking pretty good, Miss Eugenie. All right, we have a couple viewers now. Thanks for checking in with us. So Dr. B is just going to give Eugenie a nice little scrub down, and then she's going to take a look at those tumors that she currently has and figure out which ones we're going to remove today. So Eugenie has been with us since March 3rd, and she's actually from down in Ponce Inlet, which is about an hour drive south of here. Hi, Christy. Hello from Europe. Wow. So Miss Eugenie has already had 3 surgeries, and she's probably got another 1 or 2 more. What do you think, Dr. B?
Probably 2 more. We'll look when we turn her over. Most of her tumors are underneath her at this point, but I think 2 more. She is a bit sensitive. She doesn't like full anesthesia, which most sea turtles are sensitive to that, so we have to be very careful when we do general anesthesia. But she in particular has more serious complications than many of them, so we have been doing smaller surgeries with just some mild sedation and local anesthesia, which means we just numb the area around it, and that has been much safer for her. So it takes more surgeries because you can only do a little bit at a time, but she's doing really well with that. So I think 2 more.
Good job. Hello from Georgia.
But so prior to surgery, she's already been sedated, so she's a little calm and sleepy and kind of in her happy place, which is good because we don't want them to be stressed and we certainly don't want them to feel any pain. So we make sure that we get all of that taken care of ahead of time. And then, of course, just like with us or anybody, you want to be nice and clean for surgery. And these guys naturally build up just some various types of healthy algae while they're in the tanks, just from the ocean water. So we give them a nice little scrub down, and that gets them clean, gets all the algae off, allows the healthy bacteria and normal defenses to stay, and also gives me an opportunity to just do a more close exam so I can see if there's any wounds or infections, any soft spots, or tumors or other things to be concerned with on her flippers or her carapace.
Hello from Fort Carson Army Base.
Right.
Or Army Base.
Army base.
Thank you for your services.
Hey, sweet girl.
Hey, Eugenie.
We're just going to flip her over.
She does have a beautiful shell.
So this is her plastron, and her plastron is actually quite healthy. She's got a few little scars that are just from various scratches and mild injuries along her life. You know, there's all kinds of things that can hurt you out in the ocean, but sea turtles are really strong and really good healers, so that's what's left. And here you can see scars, all of these pink areas, and this is a little bit of scab left, but that's where previous tumors have been removed. These are almost fully healed. This will turn into scar tissue and fall off as a scab very, very soon. But both of these surgeries were March and early April. So typical is a couple months healing time. So those were her early surgeries, and then up here around her shoulder and her neck, there's a lot more scab material and not very much scar tissue yet. Those are more recent surgeries that were done just a few weeks ago. So that was her most recent surgery, the end of April. And then there's some tumors over here, which is what we are focusing on today.
All right, Eugenie, we're going to get those pesky tumors off. And she has been lightly sedated already, so she's being a very good girl for Jessica as Jessica holds her. You can see.
So when we sedate them, we give them a combination of medications. They're very similar to drugs that are used in people, but also in dogs and cats and all of our animal species in the veterinary world. So it's a combination of pain medications and sedatives just to keep her calm. And then we use lidocaine, which is a local anesthetic that we will inject around the tumors underneath the skin, and that will numb the whole area so that when we do surgery, even though she's awake, she's not feeling anything.
Aunt Lisa says hello.
Hi, Aunt Lisa.
And Nydia wants to know what causes the tumors.
Well, that's a very complicated question and answer, but the short version is a combination of a herpes virus and a weakened immune system, and typically the immune system is weakened because of pollution and poor water quality. And so the virus causes the infection, and then the body kind of mutates some genes and it turns into tumors. And there's a lot of research being done right now trying to figure out most effective and best ways to treat it. So far, surgery is the best option that we have to remove the tumors, and most of the time, once you get the tumors removed and get the turtles healthy again and strengthen their immune system, then they're able to fight them off and they don't get new tumors. But there's certainly a lot of research being done about chemotherapy and other medications that can possibly help us to do less surgery or make surgery a little easier or healing faster. So there's a lot that we don't know and we're still learning about FP.
So there's your answer, Nydia. Hello from Apollo Beach. Rachel Thomas gives you a thumbs up. It is a great way to educate the public on our day-to-day. Everybody thinks we usually are just hanging out playing with sea turtles, which we are definitely grateful to have this job, but there is a lot of work that goes into it. This room is our brains behind the whole operation, our surgery, our treatment, our office space, and it's acting just as an animal hospital that you would bring your dog and your cat to. Good question, Tara. How old is Miss Eugenie? So it's actually very hard to try to tell how old our turtle patients are because we don't know when they hatched. So we kind of guesstimate how old they are based on the size of their carapace, which is their shell. So what do you think, Dr. B? Do we think Eugenie is probably about 6?
I would guess she's probably about 3 or 4.
Oh, 3 or 4.
They grow at different rates depending on what resources they have available to them. So if they're in an area where they're well fed, then they grow faster. So a young turtle can become quite large very quickly. Or if they're in an area where food and resources are more scarce and they have to work harder for them, then they're going to grow more slowly. So it's hard to know exactly, but in general, with average resources, she's about 3 to 4.
3 to 4 years old. So Dr. B is using a pen to circle the areas of the tumors that we do want to remove today, and that's very, very similar to what a surgeon would do.
It looks like a Sharpie, but it's not a Sharpie. It's a surgical pen, and so it helps us, particularly when there are lots of tumors, to know which ones we're going to focus on and remove, which ones have been numbed, so that I don't accidentally try to take off the wrong tumor that may not be numbed for her. So she's, at the moment, I'm only seeing those 2, and then she has one back here on her carapace. So this potentially could be her last surgery.
Yay, that would be wonderful.
Keep looking her over.
All right.
Maybe she doesn't have as many left as we thought.
Aunt Lisa wants to know if people can catch FP.
No. There are lots and lots of different herpes viruses in the world, and they are species specific, which means the turtle herpes virus only affects turtles. You can, in fact, get other herpes viruses, but not from a turtle. And ironically, there are viral-induced cancers in people. Cervical cancer is one of those. So it's kind of a similar mechanism to get it, but it's not the same virus, and it's not contagious to us from her.
All right. Well, some exciting news. This actually might be Miss Eugenie's last tumor removal surgery, so that's wonderful news. But we're going to take a good look over her right before we go into surgery, and then of course we'll take a good look after surgery, and then she'll actually come out every couple of days so that we can clean those incision sites and monitor, and she looks pretty good. Hello, Tatiana. Tatiana is one of our volunteers that we miss having with us. We are in phase 1 of reopening after COVID, and that means we're still working in teams of 2 and no public on site. So unfortunately, no public tours right now, and that also means we can't have our amazing crew of volunteers. We have a small, dedicated team that's a staff team, and then we have our amazing dedicated volunteers. There's about 27 of them, and they are with us every day of the week, every day of the year. Turtles don't get vacation. So we're going to go ahead and get started with surgery. Thank you guys for checking in, and we will look forward to talking to you guys again next Wednesday. Have a great afternoon.
Bye.
Good luck, Eugenie.